Welcome to Real Talk in Medicine, a podcast production of UT Physicians. My name is Shelley Vanker. Joining us today is Dr. Maureen Beck. She's a gerontological nurse practitioner here at the Center for Healthy Aging. And that long title really just means you're a nurse practitioner who specializes in geriatrics.
Correct.
Awesome. Thank you so much for joining us, Dr. Beck.
Thank you.
So we are excited about this episode because we're going to dig into healthy aging and the misconception that aging is bad.
Right. That's correct.
We're going to talk about the way that you can live a long and healthy life and enjoy that healthy life. Yes. One of my favorite pieces of data that we dug up and researched for this episode is that at the Center for Healthy Aging, you guys are treating nearly 24 patients who have reached that 100-year milestone.
Yeah, it's remarkable.
Very incredible. Yeah. And you have a really fun story that we'd like to kick things off with about treating 3 of those patients back to back one morning.
Correct. One day I had 3 patients that were all over 100, and one was about 103. They were all very different. One just kind of asked every morning, why am I still here? And the other 2 just grabbed life by the reins and were really happy to be alive and participating in their family and anything they wanted to do. So everybody was different, but it just showed me that getting to 103 could be a good thing. It could be a challenge, but they all took it a little differently.
Yeah, very well said. I saw a quote recently, and it was that, and it really resonated with me, especially for this episode, that everyone gets a chance to be young, but not everyone gets a chance to be old.
Correct.
And I really want to dig into that. Let's say that you do want to be old and you are fighting for that chance, right? Mm-hmm. Talk to me about the commonalities that your 100-year plus, we like to call them centenarians, what do they have in common? What did they do? What have you noticed that got them to 100 plus?
Well, as I know, depending upon your life experiences, you're going to approach every day differently. But this group of people have been through a lot of challenges, from epidemics to wars to battling back from depression, and I mean economic depression. They've seen the world change from the time when they had to, have a dial-up telephone to using cell phones very successfully too. So what do they have in common? They've breached a lot of challenges and bridges to get where they are today. They've had a lot of good family support early on. Consistently, people lived closer together. They may have taken care of their own parents and watched them age. So there's a lot that they have in common as they've gone through the decades. And then things just kind of started to change as families moved away. So then they had to be more independent and meet the challenges on their own sometimes because their kids lived across the country. They've generally retired, but some of them are still working, even in their 90s.
That's incredible. Mm-hmm. What types of careers are they still doing?
I have the folks in their 90s who are attorneys and have practices. They're still working and they want to continue to work. I think the lawyers are the ones that are still working the most of the patients that I have. Mm-hmm.
Because I guess it's more of a mental exercise versus physical exercise.
Probably. Then I have a lot of volunteering. People love to volunteer and give back to the community, whether it's a church or to schools. And some people are in quilt groups or they're very active in their community buildings with bridge groups and things like that they really thrive on doing those group things together.
What I'm hearing is that a commonality is that they get out of the house.
They're active. They have something to look forward to when they get up in the morning, yes.
They find that purpose.
Mm-hmm. Yes. So eating healthy, being active, challenging your brain really helps you to age healthfully. Being active is very important too, whether it's just getting up out of your chair and walking around or actually going to a gym. As long as you're active, that really helps your brain.
And what is it like for you as a nurse practitioner to be able to treat these patients who have gotten to this milestone? Do you learn from them?
Oh, most definitely. And one of the things that I do with my patients is when I first see them, I try to find something we have in common, whether we both lived in the same place or we have a common craft or we like to do genealogy, which I like to do. I learn about them so that at every visit I can bring something up about something that's particular with them. And that helps me understand how they're aging and see if they're no longer doing what they used to love to do. For instance, if I see that I'm having trouble with managing my bills and they were an accountant, or they can't manage just doing email anymore and they used to be in computer science, or just examples like that, tell me there's something going on because now they can't do what they used to do, and they used to do it successfully.
And do you also take it as a privilege that they've chosen the Center for Healthy Aging and your care team to see them through what they must now certainly know is end stage of life, right?
Right. So our patients really want to come to a geriatric clinic. They may have been in family medicine or internal medicine. They choose to come to a place where we understand how important function is, how important all the ins and outs of pharmacology are for them, that we understand the challenges they're going through as they age. So yes, it's a privilege to take care of them, and it's wonderful to know that they want to come here.
Yeah. Oh, I love that. Okay. So I want to talk a little bit to the younger generation and younger populations out there. How do we get to the 100-year milestone? What are your top pieces of advice or tips that we could do? You can't just wake up and say, this is my new goal, right? You have to actively.
It's never too late to make a change. Let me just say that.
Perfect.
But if I could take these patients back 20 years or more and say, you need to exercise, you need to get out and walk if you don't run or don't like to go to the gym, you need to eat healthy, work on sleep and socialization. All those things are key to aging healthy. Having a support system is very important, but people have to start taking care of themselves and do all the preventive things early on. You can't expect that you're just going to get to 80 or 84 without doing something to help you do that healthfully.
I want to hit on that topic of socialization that you just mentioned. How important is that? Because I think that we've all heard eat right, get exercise, drink water, sleep well. But the socialization, I think, is a really interesting aspect of that.
It is very important to have a support system. In fact, it doesn't have to be your family, friends, people you have something in common with. A church or a community center is really excellent. But if people isolate in their homes and they don't have someone that they can reach out to if they're in a struggle, in a crisis, or they just want to talk to somebody, they need to develop that before they get into a bad situation. And I think sometimes we see that our patients spend more time talking to us about their fears or their challenges because they don't have someone else to talk to. So a good portion of our appointments are listening. Listening is key. They need someone to listen to them. And that's part of socialization too. Sitting around the table at an assisted living with the same folks and getting to know them and participating in volunteer activities helps build up that social web that they need.
And so even for younger folks, it's joining groups.
Yeah. Getting
people that
you
are
may
your
not
age.
have a skill or a craft or something that brings you together with other people, but if you're going to the gym regularly, you're going to see the same folks, even if they're not your friends, and they kind of become a little group that I remember him, he was here last week, and you watch them as they're progressing when they're exercising. Or if you're younger and you like to run, getting involved with a run group, getting involved with a volunteer group from maybe your high school or college is really important too.
Yeah. In college, I remember our entire dorm would just go volunteer regularly together. And we didn't socialize outside of the dorm really together because we were completing different majors, we were in different social circles. But as that volunteer, every Sunday we would go as a group. Yeah.
I do have people who have done Habitat for Humanity for years. So they started that when they were younger. Now, they probably can't do the same hammering and lifting that they did before, but they're still involved with that. That's really important. Red Cross and many different organizations around Houston can use volunteers early on. Then you get to kind of go up the ranks if you want to have more responsibility. But it's important to start that early.
Yes, very good. So I'm going to just recap real quickly the tips that you've given us. Be active, find that social support, which is the one we've really been honing in on. Maintaining your hearing was something that you had mentioned to us previously. You talked about hearing and why that is so vital.
It's very important because if you're losing your hearing, you're going to mishear things that people say. So it's going to lead towards a avoidance of situations where you could look embarrassed because you answered incorrectly. So people tend to pull away from group and social activities when they can't hear. They prefer, I'm not going to go to the wedding because I might not hear something. So hearing is really important for cognition, for memory. Very important to keep up your social network too. And people often don't want to get hearing aids because of cost. So we try to work with our patients to help them find ways that they can find more cost-effective hearing aids and not shy away from it. Also in our office, we use pocket talkers, which they wear during the appointment. So if they don't have hearing aids, they can hear us. And it's really a much more valuable appointment when they can hear us and we know that they understand what we're saying. So we take them out of the box and put them on our patient, and it makes a big difference in the appointment.
Oh, wow. So prioritizing your hearing health as you age.
Definitely.
Yeah, that makes sense, leading to like a decline in socialization if you don't feel comfortable.
You're just not going to go out the door.
Yeah.
You're going to eat in your room.
It's a domino effect then, yeah. Wow. Healthy diet, brain activity. What are examples of keeping your brain active?
Learning another language. I started on an app when COVID began.
Yeah?
And I'm doing Italian every day.
Oh my gosh.
Yeah, and just for about 10 minutes, just to keep up vocabulary. But learning something new. It doesn't have to be a language. Pulling out a pen and pencil and paper and drawing. Drawing is really effective on helping your brain. Learning a new skill, which could mean joining with another group to learn how to do it, like a pottery group or a sewing group, or for men, a woodworking group. Anything like that that helps you to learn something new. Reading, whether it's a novel, a Bible, reading is really important to stimulate your mind. And still we're telling people to do puzzles and coloring. I know that sounds basic, but for some of our patients, that's the way to keep them active, is staying inside the lines, just coloring, not having to make a Michelangelo piece, but coloring.
No one is expecting a master of work, right? From your coloring page. But they do have those adult coloring pages now.
Oh, the spirals and all those things, yes.
Yeah.
There's a lot. And National Park books to color in every national park. Actually, my daughter has one of those.
Oh, wow.
And we just got her all the pencils to keep doing it.
Yeah, very nice. And then, the last tip that I had here was to avoid polypharmacy. Explain what that is, and then how that could escalate over the course of your process of aging, and then how to avoid it.
Right. So we used to say polypharmacy was more than 5 medications on your list. And now people will come in with 10 to 12 meds. So part of the problem with polypharmacy is that a medicine may have been started during a hospitalization or 5 years ago. And every time you go to the doctor, it just gets renewed because you asked for it to be renewed, or they renew it. Or you start with a new provider that sees, here's this list of meds. Well, you want them all renewed, we'll renew them. Are they really still necessary? They may have been started for a particular problem and they never get stopped. So we try to take a look at the medications carefully to see what medicines are not good for our patients that need to be removed. And then we look at interactions between medicines because as people age, their body uses medicine differently. For example, medicine could be digoxin, which keeps your heart regular. We have a lower limit for the level of it in your blood than someone who's in their 20s. So we look at, are you toxic? Do we need to reduce that dose because you have too much in your system? Because your body can't eliminate it like it used to. There's a lot of science behind that. We're very lucky here at the Center for Healthy Aging to have a doctorate in pharmacy a PharmD, that person's called, who can look at these issues with us and help us to eliminate the meds that someone doesn't really need to be on or change the dose effectively. So polypharmacy is being on too many drugs.
Mm-hmm.
And
you
dangerous
want to avoid,
drugs too.
Yeah.
Yeah.
They can have interactions, right?
Looking at that. Yeah, how your body uses those medicines. Maybe you need to be on a lower dose, like I said, or maybe you don't need to be on that at all. And then we have to go over maybe 3 months of tapering someone off of an anxiety medication. They'll say, I've been on it for 20 years. I don't want to take it off. And we explain to them why it's not good for them. It doesn't really help them sleep. It actually makes sleep worse. And it's really hard for people to make changes like that because they rely on those medicines for many different reasons. But that's part of what we do here is a lot of teaching and explaining and trying to work with our patients. We try to come up with a good in-between and work with them to at least reduce them.
Yeah. Yeah. Okay. Very good. And you hit on kind of a specific topic I want to jump into next, that your body changes as you age with getting rid of medicine from your body, from your blood. What is it about turning 65? Because that's the official age in which you become a geriatric,
So
right?
65, that was made up in Germany when they developed their first pension. Kaiser Wilhelm said it was going to be 65. Actually, he dropped it down. So it's not a real thing in my mind.
Okay.
But people look at it that way. That's when I'm going to retire. I'm now old. I hear a lot of people tell me they're old now when they're 70. And I always tell my patients, you're still young. You are not old. So 65 is just a made-up number that we use with the government, but that is the number that we say you have to be 65 to come to our clinic.
Right, okay.
Because that's when people are starting Medicare, officially.
Which makes sense.
Yes.
So how does our body change, though, as we age, as you hit into the 60s and 70s? What is it about that aging process that makes it harder for your bloodstream to get rid of medicines? It makes it harder for your muscles to build muscle.
So it has to do with our liver, it has to do with the fat concentrations in our body, and we all know about that. So we metabolize and excrete or get rid of medicines differently, and we break them down differently. So sometimes they stay in our system way longer than maybe someone who's 20 years younger than us. And then the toxins can build up from certain medications. So we look at how your kidneys filter and we look at how your liver is working when we prescribe new medications, for instance. But as you know, people can add more fat to their bodies as they get older, particularly if you're eating not the best diet and you're not exercising and sitting a lot. So the added fat makes a difference in how your body metabolizes medications. So how do we age? We age differently. Everybody ages very differently, but we can become more frail as we move into our late 70s, 80s, not as strong. Osteoporosis can be a factor for many people where their bones are weaker. If you haven't kept up with your exercising, your muscles won't be as strong. Your balance can be off. So you have to take that into consideration. Then people don't want to go and walk and exercise because they're afraid they're going to fall. And if they've fallen, it's going to lead to fear of another fall. So there's so many factors that lead to aging. But overall, I think what we see is there's a general gradual decline in muscle mass, increase in fat, decrease in strength. And we try to measure some of those things in the clinic too.
And all of those, you can't turn back time, right? But you can slow down the clock, right? By doing, is that?
So if you do exercise regularly and you do try to work on weights a couple times a week and work on your cardio, which is 150 minutes a week of cardio is what they recommend, you can actually improve your mitochondria, which are these little cells in every one of your cells, to help kind of turn back the clock a little bit.
Okay, so you can.
So you may not look younger in your face, but you can make your body stronger and a little bit younger, yes.
And then feel better.
And actually, if people don't want to exercise because they say it's too much work, get out there and exercise and you'll start to actually feel stronger and you'll want to do it because it makes you feel better.
Yeah. Okay, I love that message. You can turn back the clock a
little
little
bit,
bit.
yeah.
A little bit. All right. Heard it here on Real Talk in Medicine. So let's talk a little bit about bone health and then
Okay.
immunity as you age. How does your bone health change and what can you do to keep your bones strong?
Okay, so people have heard of osteoporosis, but maybe not osteopenia. So if you're a woman and you have a Northern European background, and maybe you're pretty thin, possibly smoked in the past, maybe been on some medicines that can affect your bone health, like there's a couple of medicines, steroids and things like that, you're going to weaken the bones. But the genetics of you, for instance, you're a female, when you get to be over 65, your risk of bone weakness is going to definitely increase because you're postmenopausal at that point. So we can't stop you from being female. We can't stop your age. We want you to continue to age healthy, or your family history, if your mother had osteoporosis. So we can't affect that, but we can affect things like alcohol, smoking, the medications, activity level, all impact bone health. Sometimes people cannot avoid being on a steroid, but knowing that the steroid increases your risk of osteoporosis, you take that into consideration. So osteopenia, though, is the stage between normal bone and osteoporosis.
Okay.
And at that point, with DEXA scans that we do every 2 years, we keep an eye on the health of these bones. And if it gets to the point where we need to give medication, we have an osteoporosis clinic within the Center for Healthy Aging. And we do a lot of really great testing in there, blood work and balance and all sorts of things like that in our clinic. And there are many options besides pills now, including shots and IVs, which have been around for a while, to help improve bone health and grow bone.
Oh. So it's more than just drinking milk.
It's more than drinking milk. Sunshine, too.
Okay. Oh.
The sun on your skin helps you to use the vitamin D that's in the milk.
Oh, wow.
So we check on calcium level, we check vitamin D, we do the bone scans.
Okay. Okay, very good. And your immunity, how does your immunity wane as you age?
Well, you got it right there. It does. It does wane. And that means that you may be more prone to illnesses, take longer to fight back. The flu, for instance, which is a problem right now. You have to take that into consideration when you're having frequent infections. You know, you're not fighting them as well. And sometimes medicines that people are on will reduce their ability to fight an infection too.
Okay.
So we keep on top of that.
And that goes back to you don't want to be be experiencing polypharmacy.
Right, but there are medicines that sometimes people cannot avoid because of the illnesses that they have. And there are a number of chronic illnesses that folks age with that might have killed them decades ago are now things that we live with. And that goes hand in hand with the medicine you have to take for that chronic illness, like heart disease or a lung disease or a rheumatological bone disease. And then you are medicines to keep you as healthy as possible because you have chronic illnesses. Maybe you have 3 or 4 chronic illnesses that you're trying to manage. And you need the medicines to keep you functioning. Can't avoid those.
Right. And so then I guess that leads us into vaccination. And as you get older, those vaccinations actually are higher doses or?
Well, we have a high dose flu shot, yes. That's important for anyone who's getting a flu shot. And it takes 2 weeks for the flu shot to be effective. But yes, we recommend that's what we give here is the high dose flu shot.
Okay.
And keep on top of how frequently you need to renew your immunizations too.
Yes. Very good. And so let's talk about if you wanted to come make an appointment with you guys at the Center for Healthy Aging. Is that easily done? Do you need a referral? What type of patients are you guys taking?
So we're taking people over 65. But there are times when a person may have dementia and be in their late 50s, and that's a conversation we should have because we do take patients at that point. No need for a referral. There's a little bit of wait because we are, in the nation, we have not a lot of geriatricians and gerontological nurse practitioners. So you have to have a little wait to get into our clinic, but it's worth it. We do spend an hour with our patients on their first visit, and unlike other clinics, we have 30 minutes for our established patients. So there's a lot of benefits to coming to our clinic. Yes, self-refer. It's nice to come here, very pleasant environment. And I have to say, my team is great, but this morning I was thinking my team is all of UTP. Mm-hmm. Really. The number of folks that I can refer to who respond back to me so quickly make it a very valuable place to work for our patients.
Yeah.
And valuable for me in that I've got referral people, but they take our patients and take good care of them.
Yeah. And I like to say we're the center for specialists. We have every specialization under the sun available at our fingertips within our UT physician system.
That's correct. Mm-hmm. And we're happy to be one of those specialists and do primary care at the same time.
So let's talk about what would be a key element of going through a geriatric appointment at the Center for Healthy Aging. You mentioned that it may be a wait, but once you're in, the initial appointment is an hour, and the patients who are already established are 30 minutes. And then what are you guys looking for during those appointments?
So during the first appointment, we do a very thorough history and physical. And unlike some other areas, we look at function. I'm always asking people, do you need help with the basics like dressing, bathing, getting in and out of bed, walking? Do you use a walker? I mean, if it's not obvious and the person's very peppy and 65, I know they're not needing that. But sometimes people get brought in by their children. So we look at function. We look at their ability to manage their finances, their medications, which is a higher level of function. Who's doing that for you if you can't do it? Are you still driving? I ask people, have you had an almost accident? Because people don't like to talk about that, right? I didn't ever have an accident, but did you almost go through that red light? We talk about who's doing the laundry, who's doing the dishes. Are you planning the meal and shopping? Because people eat, but who's doing the cooking? Mm-hmm. So we ask about all of those functional levels. We review their immunizations. We try to get a very thorough picture of their support system, which we've talked about earlier today. Who do they rely on? How far away is your child? Are they in Boston or are they around the corner? Mm-hmm. And are you in a 1-story or 2-story house? I always ask that because stairs can be a problem. And do you have the lighting? Do you have handrails? So we go through all of those things that aren't part of a typical appointment. Also, we do often a memory test, a cognitive test, a short one or a long one, depending on the situation. Then after we do a review of systems with every part of your body, we do our physical. And I always check people's ears because we were talking about hearing. Wax can be a problem. And then once we look at their medicines, we talk to them about meds they probably shouldn't be on or adjusting medications and make sure they know that we're available 24 hours a day in our clinic.
It's a very thorough appointment.
Very thorough. It takes an hour. Sometimes they have to come back for more of it. And then we decide who to refer them to if they need a referral. And we make sure we have their pharmacy information too. That's quite important.
Yeah.
And we also look at end-of-life issues, for instance, durable power of attorney for healthcare and what we call the living will. And if they don't have that, we give them the blank copies to take them home and get them filled out.
Oh my God, like a full service.
Definitely.
Very comprehensive.
It's a comprehensive geriatric assessment.
Yes.
That's what it's called.
Oh, wow. I mean, that's just so wonderful because there are so many little things you aren't thinking of every single day about your total health.
Mm-hmm. And then, of course, we also look at when did you have your last bone scan, mammogram, and all the other consistent lab work that people need to do. And get that ordered, and nicely we can get the labs done here, and most people can get their imaging done in this building. I'm
going to go through with you now your most frequently asked questions. What are patients coming in and asking you about as they age?
A frequent asked question would be about how to keep my mind strong, which we've come talked about. So we review those things with them.
Do they ask you straight up just how to avoid dementia?
Sometimes.
And can you?
You can reduce your risk. I'm not sure I could tell you could completely avoid it. There are many kinds of dementia. So from people who have a stroke history or a family history of stroke and cardiovascular disease, that's very different. But there's mixed dementias too. So we do talk about the things, like I said, being physically active and engaging your mind, social support. I talk about that with my patients all the time too.
Okay.
Other things they ask is, how many meds can I get rid of? Part of what we do in our clinic is we ask people what matters most to them. It's part of the age-friendly health system that we've been a part of since 2017. And we look at their mobility, their mentation, so depression or memory loss. We look at their meds and we ask them point blank, what matters most to you about your health? And that's where we get a lot of good answers, and we try to help them keep on that goal.
Okay, very nice. Do they also ask you about vitamins?
Yes, and supplements. Okay, so I don't have a degree in nutrition, but we do have 2 nutrition folks here available at our clinic. We have always had a path towards minimal expense in the vitamin area. We know vitamin D is important and we test people for that. And if they're on 2 or 3 different multivitamins, for instance, one for their eyes and a regular every day, we try to tell them to stick with just one of those. And we really don't push supplements.
Yeah. I want to touch on vitamin D there. Why that specific vitamin?
That's going to be helpful with muscle strength and balance and bones.
Oh,
That's
lot
the
of
milk.
things. Yes.
Yes.
The milk and sunshine combination.
Right. So we do test vitamin D when we can, when it's appropriate. If it's low, we increase that vitamin D with a high dose, and then we put them on a maintenance dose of vitamin D.
Okay.
And in fact, people who don't ever get out of the house, like people who stay at an assisted living facility and don't really go out, can have an extremely low vitamin D. So we look at any kind of connection with falls, test it, and supplement them.
Okay, so
that's
vitamin D is
important.
very good. Yes.
Very important.
Good to remember that one. And then blood pressure. How do you monitor their blood pressure? What should it be as
That's
you
a tricky
age?
question.
Sorry.
Sometimes there's a little disagreement with cardiologists.
Okay.
Our philosophy generally has been that and it depends upon someone's individual physical problems, but a very low blood pressure is generally not good for our patients because we check it sitting and standing. And if it drops 20 points or more, we know they're dehydrated or maybe their medicine's too strong. So we say if we can keep it under 150, we're happy.
Okay. Alrighty. And then they also talk to you a lot about aging in their own home. You mentioned a nursing home.
Yes.
I think facilities people try to avoid at
Yes. There's so many options in Houston now that give people a lot of flexibility. Many people want to stay in their home forever, die in their home, never leave their home. So I talk about that. I talk about what the options are. At some point, they may have to make a decision. They have to move. So we talk about how much it costs to have in-home care, what you need to change in your home, like elevated toilet seat a little higher, a roll-in shower, handrails on the stairs, eventually maybe a ramp if you need to use a wheelchair all the time. We talk about all the adaptations that need to be done in a house and basically who's the support system for you if you're aging in-home and you can't drive anymore. Nowadays, of course, we can get everything delivered, right?
Right.
10 years ago, it wasn't like that for people. If they couldn't get to the grocery store, they depended on a neighbor.
Yeah.
But now you can order if you're able to do that. But we have a lot of people who want to stay in their home. And yet, I have people who have already made their plans. They're selling their house. They're moving to an adult community that has assisted living or has assisted living and the nursing home component, so they can stay there as they age. It's called a CCRC, and everybody's a little different.
Yeah.
And some people don't want to move to be with a child either. There's a lot of downsides and upsides to being in another part of the country when all of your support system and physicians and NPs are here. Then you have to set everything up from scratch again. So there's a lot to think about.
A lot of independent decisions there have to be made, I bet, on a case-by-case basis.
And sometimes they can't make those independent decisions. They may still want to live in their house, but it may be dangerous. There are times when we have to call in some help, like Adult Protective Services,
Okay.
for people who maybe aren't making a safe decision.
Okay. Would you say, though, now, today, in 2026,
Yes.
It is easier to, or more realistic, to attain the 100-year milestone than in years past?
Well, I know you weren't around when they had an ad on the news in the morning. They'd say in Minnesota, Joan Smith turned 100, and it was a big deal, and they'd have it on the morning news. Now, I think it's a whole lot easier to reach your late 90s up to 100 than it was before, because we're treating all those chronic illnesses that would have killed somebody years before, and we have a lot more in place to help support people with home health and the places that they could move to stay vibrant. I think that it's easier than it was. I agree.
So it's a goal we could have.
You could have.
You could wake up tomorrow after listening to this podcast and say, that is now my new goal.
You want to age to 100 in a healthful way, though.
Yes.
Because you can reach 100 and not be so healthy. But if you make the right steps now, you can lead your body towards a more healthful procession towards 100.
It'd be getting rid of the stigma that you don't want to age that society has put on young people.
Right. Everybody's trying to look thin and trying to look younger. I made a personal decision not to dye my hair anymore because what was I hiding? It was there anyway, right? So
and more cost effective.
It was so much more cost effective to do this. And I think that we have to be role models within medicine to show people that we're not afraid of getting older, because it happens every single day. And I think the positive goal is to wake up and have a great day and look forward to being with your family or your friends. We have so much we can offer each other, and there's no point in being depressed about the next day being 1 year older or your
sad about a birthday.
Yes. But the people have losses. But I think overall, people these days can age healthfully, and we're here to help.
Yeah. Aging is worth celebrating.
Definitely.
Yes. Ending with my favorite quote that I recently just saw, that everyone gets a chance to be young, but not everyone gets that chance to be old. And
Correct.
that it is worth embracing and taking it in and not dyeing your hair.
Well, you can dye your
Learning
hair.
Italian.
You can dye your hair, but I made that decision not to embrace the fact that I wasn't 50 anymore.
Yeah, and I love that. I mean, I like what you said about being a role model within the healthcare world that you serve.
Thank you.
Very wonderful. And it's just been such an enlightening conversation. Thank you so much, Dr. Beck, for taking the time to talk to us.
Oh, great.
And for highlighting the Center for Healthy Aging. Thank you for joining us on this episode of Real Talk in Medicine, a podcast production of UT Physicians.